So, once again, thank you for attending. Appreciate you being here. We have a lot of ground to cover today. The opioid epidemic is not getting better at this point. COVID has really isolated a lot of people. So we're working to readjust servicing, readjust access to care, all kinds of stuff happening out there. It's an exciting time for us all. Things are changing in our community as far as how services are being provided, how people can get into them. I'm so glad to see everyone on here. As we've all heard, we've heard settlement funds are coming out at the state level, at the local level. So we're seeing a lot of programming being developed. Critical that we all sign in, that we're here to support each other, and that we're here during these times. So at this point, I am going to ask Barbara Burns. And let me pull up her PowerPoint. And I apologize, it's a little choppy. I just got it from her. So I'm going to pull up her PowerPoint separately for her and ask her to start. So Barb, are you on and ready to go? You all set, Barb? Maybe, possibly. No, no, Barb. I know she's on here because I saw her. I'm just wondering if she can't get herself on. All right. Well, we will skip over Barb then, and we will move on to the treatment providers. And when she gets on, we'll take care of that. So I apologize for jumping out of order here, but when Barb's ready, we will take care of her. So on this note, I will turn this over here to John Greco and to Jennifer Sieb, who are running this group. They have a lot of great information for us. And we'll get started.
All right, thank you. Thank you, Cheryl.
Thank you.
So my name is John Greco. I'm the Assistant Commissioner for the Erie County Department of Mental Health, and myself, along with Jen Shive, as Carol mentioned, are the co-chairs for the SUD Treatment Provider Work Group. And you can go right past that slide, please. All right, so those are the three committees that we have established, two long-standing ones, and then the newest one listed at the bottom there, the Education and Training Group. Next slide. So the increasing access to SUD housing, that committee is facilitated by myself, and we meet about once every 3 or so months. Our next meeting is June 27th at 1 o'clock, and everybody's welcome. And if you're interested, please email me there. My email is listed at the top of the slide. So just by the nature of these projects, they do tend to take some time to develop from idea to the groundwork to actual implementation. But we have a few today that we just wanted to highlight that are in various stages of this. Some close, some more at the beginning stages. But first off, Best Self Behavioral Health has an exciting project. They label it their Mount Erin project, and they're going to be offering 18 beds of SUD housing. Originally, that was looking like April 15th, but now I believe Jen's going to reference it later in the slides. I think we're talking more like June, but still, beginning of May now, so still pretty close to being imminent, so exciting. A couple of newer projects, I believe they are ESHI funded by Restoration Society and Casanova Recovery. Those are more to initial stages, offer a lot of potential, but right now they're at the site location stage of the planning process, so we'll keep an eye on that one. Living Opportunities of DePaul had reported to us that their Pan Am project on Delaware Avenue, quite expansive project actually, is going to be, or hope to be breaking ground in late August of this year. And that's notable because, most folks, if you know about DePaul, they are not a traditional SUD housing provider. So when we first initiated this, they were kind and gracious enough to commit a handful of beds or so of this project for the population that we serve. So we're grateful for that. We're excited about that. And lastly, for today, Evergreen Health is looking to hire a staffing position, and we all know how challenging that is presently, so that they could implement the 12 SUD transitional supported housing beds that they were awarded from the Erie County Department of Mental Health. So hopefully we will be hearing more about that in the not too distant future. Next slide. So our newest committee is already starting to have a positive impact, and they've kicked off some nice little projects here. Right now, they're focusing on harm reduction as well as religious and church outreach. A lot of these things have occurred actually within this last week. So this past week, they had a virtual presentation related to harm reduction philosophy and practice, and that was generally geared to the support and provider community. And we really want to thank the staff of Evergreen Health and Evergreen itself for having their staff take the time to do a presentation for us. And that's part of our monthly lunchtime series. So this group is facilitated by Amy Rockwood with a great deal of assistance from Tara Koleski from our department. In addition to that, we're also hearing that family members could benefit and would like to know more and do well to learn more about harm reduction from their perspective. So a planning meeting occurred, I think, this past Thursday or Friday to take a look at how a presentation could be offered for their perspective. And in addition to that, we're also hearing in our work group meetings that there's a desire to help family members be more involved and more consistently involved in the treatment of their loved one, whether or not that person is actively in treatment or not. So we're really excited to be having the voice of the family members at our committee, because we really couldn't do it without them. And that was the beginning of that was also discussed this past Friday, although we know that some family members were not able to attend. Juliana Everdyke, our Director of Dual Recovery and Community Integration, is facilitating that piece. So we're thankful for the providers and family members that are participating. So we're excited about that as well. And then also this past week, there was a religious church outreach to Prince of Peace Church that occurred over on the west side. There was a number of provider and support agencies that offer services in that general vicinity and community that were there presenting tables and tabling information and answering questions. The meeting itself was facilitated by staff from the Erie County Department of Mental Health. So a nice shout out goes to Commissioner Mark O'Brien, Tara Koleski, Amy Rockwood, and Juliana Everdyke, who were there to present the slides and answer the questions. And my understanding is that folks were quite well engaged, answering a lot of questions. The presentation and discussion went further along than it was anticipated. So by all accounts, very well received. So we're expecting there to be follow up with that and hopefully some additional outreach to members of the religious and community. So a really nice start there. And if anyone is interested in participating in this group, please email Amy Rockwood, and her email is listed at the bottom of that slide. Next slide. And as far as committee updates go, last but not least, improving access to medication-assisted treatment in the community. This one is facilitated by co-chair Jen Scheib with a big assist from Dr. Tilly-Beth Dosher. So they're looking to improve community collaboration with primary care. And much like with the housing committee, this is one that's just requiring time and patience and perseverance, and kudos to them for having all three of those. But there remains a lack of funding to develop outreach and a resource team. However, we've had some discussions, and while there certainly have been no decisions made, and I need to stress that, as we gather some suggestions and recommendations for the opioid settlement dollars, this was looked at as one potential use for some of those funding, so that there could be an in-reach education team linked to primary care to serve as a resource for those primary care offices that might be seeking facilitation. And they were really just looking to better support primary care and helping them to assess and identify substance use with their patients a little bit more readily and accurately, but also to more easily link up and partner with substance abuse providers who are providing medication-assisted treatment to their patients. So we will continue to plug away at this group, or this issue that this group is plugging away at, and they are next scheduled to meet the middle of May 18th at at 12 o'clock. And folks that might be interested, you see Jen Shive's email at the top of this slide. Next slide. So we're looking at our quarterly update here of our methadone maintenance access. And if you look at the bottom of the left column, you see that in April, we're up to 2,532. So that's the most we've had since way back in 2020. And if you look at this, since we first started back in January 16, the community is up to about 1,250 additional slots. So almost double where we were 6 years ago, and 700 slots further than we were just as recently as January 2018. So the community providers and the community has really done quite well to, at least from my vantage point, to expand our methadone maintenance slots by such a high number and quite a high percentage. That said, we still have a wait list for slots in our community. Now in April, we are down from, we were quite high in January. I think it was our highest number that we've had since we started tracking this. So we went from 256 down to 167. So that means an additional 90 people were not on the wait list, and hopefully they're engaged, but we're down to 167. And we believe that maybe we're starting to see some of the first benefits there locally for the new methadone maintenance program, opioid treatment program that opened up in Dunkirk down in Chautauqua County. Cheryl, next slide. So this program is operated by Promesa. Some of you know them by also their larger organization, Acacia Network, and they offer methadone in our community. So they were able to open up one. Kudos to them, because it took quite a bit of time and effort and, again, perseverance. But they are now operating this service that really offers a large cadre of services. Of course, we're focused here today on methadone maintenance and other medication-assisted treatment services. And we know that our wait list in Erie County was more and more so being increased by the number of people from down in our southern county. So it's good to see that that's being alleviated some, and initial word is that people are being transferred down there, and more folks are being served there, which is good. It's good to help increase access for folks here in Erie, but certainly it's good for folks that live in the southern part of our county and in Chautauqua, Cattaraugus County, so that they can be served closer to home. So it's a great thing to see this having been initiated. Next slide. And as we always do, we just want to remind folks that the addiction hotline at 831-7007 continues to be operated 24/7 by our friends at Crisis Services. And to the extent that you may not have, we just ask that if you could please put this information and resource on your website in a prominent location so that folks can see it. Even if you're not a direct substance use or support provider, please put it on there. Please put it on your educational and promotional materials, and perhaps every now and then, send it out on a social media blast so that it gets out there into the community. The more folks see it, recognize it, the more folks will continue to access it. And we continue to have a very actively engaged provider community, treatment and support services that are continuing to develop new services, strengthening access, and new offerings all the time. And today, Jen Shive is here, our co-chair, to share a sample of those in terms of what's going on in our community. So Jen, next slide, Cheryl.
Thanks. You can hear me okay?
We can.
Okay. So I just really wanted to share some of the things that are happening in and around the treatment providers and what people are working on. Everyone's doing really tough work and really, trying to tackle all of this every day. And so it's great to kind of take a moment to think about and highlight some of these things. So I just have some things here listed, but Spectrum Health is collaborating with Evergreen to expand and enhance MAT and peer services. Another really important initiative is Evergreen is expanding their drop-in services for people who use drugs this spring in downtown Buffalo. And this is in response to the need for more low threshold services in our community. And I just think, you know, knowing as we're talking about the opioid epidemic and people not surviving this, we need to find ways, how do we engage people where they're at and bring them the care that they need. And I think that's excellent that's happening. Next slide. Also, Evergreen is going to be again doing a harm reduction conference, which is coming up August 11th and 12th. So just to be on the lookout for more details about that and how to register if you're looking to attend that, which I highly recommend. Also, Evergreen's expanded low threshold buprenorphine to their Jamestown site, and they also have openings available for that. So I have Emma listed here as the contact person for any questions there. Next slide. Another really important initiative that Horizons is taking on is to work with people with hepatitis C, and obviously we know that there's a high rate of folks with hepatitis C who also are you know, substance users. So being able to increase assessment and, you know, support and treatment for people with hepatitis C is a great initiative that we're doing to work with people. All right, next slide. John already spoke to this a little bit, but just a little bit about some housing things that are going on. So the Mount Aaron site is looking to have 18 units for individuals and families with a primary substance use diagnosis. This is permanent housing for them. And we're looking for June as an anticipated open or start date for that. Also, there is housing available through through COVID funds for the Rapid Rehousing Initiative. So this actually we're helping to support, but the Homeless Alliance of Western New York is where referrals for this program go through. So if you know someone that is in need of housing because they lost housing or ability to pay because of COVID, they might be eligible for this program. Okay, next slide. One of the things that I wanted to highlight that is the Western New York Peer Workforce Development Center. This is a collaboration between Best Self and Prevention Focus. And I think as we think about ways in which we support individuals in our field, I think this is a kind of a highlight. So this is a place where folks who have lived experience and want to be trained to become a peer, a certified peer recovery advocate, they can attend this some coursework, and then they also get matched with a peer mentor, so someone who's been doing this work, and they go together, they go to different sites, different levels of care, so maybe outpatient, maybe mobile, you know, just different types of things, and they learn and through, you know, working with that mentor as well, how to engage people. And I think, and this is also to help support them gain employment in the area. So if you're a treatment provider that is needing peers, please connect to the Peer Workforce Development Center, because you're going to get really, you know, highly trained, ready to go folks. And if you have people in your programs that are looking to become peers, please send them this way where they can get that support. All right, next slide. And then this is just an announcement that Best Self just received a notification of award for a mobile OTP. So this just came out. So there's a lot of details to come out. So I don't have a lot of additional information, but just another exciting opportunity to get the right care to the right people in the right place. So very much looking forward to that. Yep, that's it. So I don't know, John, if you wanted to kind of wrap it up.
Yeah, I can. You could as well. But our next meeting is May 23rd, 10:30 to 12. It's always the last Monday or the fourth Monday of the month. And typically we've been doing webinars, and although we have moved on site, most people are still electing to do a WebEx. So we offer both pieces. And, just again, we say it every time, but it's no less sincere than it was the first time. On behalf of Jen and I, we just really thank everybody for their support and all their work and their dedication to this issue and cause. So thank you very much.
Thank you so much for everything that you've done. And I am going to mess up the schedule a little bit and get Barbara Burns on here now. She was able to sign in. Let me pull her slides up for you.
There we go.
Okay. So we have Barbara Burns in the community education group here.
Good morning. Can you hear me, Cheryl? Cheryl, can you hear me?
Yes, I can.
Excellent. Sorry, everybody. I was having a little bit of computer trouble this morning. Imagine that. Good morning, all. So as far as the Community Education and Prevention Committee, Cheryl, can you flip to not the next slide, the next one? There we go. So as always, at each of our meetings, we do our who's doing what and what's going on. And I'm always so encouraged. I was encouraged before pre-pandemic at how much was going on. I think I'm even more encouraged during and kind of as we're hopefully sliding out of the pandemic, because all of our organizations involved in our committee have continued to do really amazing things. So we continue to share what's going on, and then promote, uplift, and support in whatever way we can. It's the weather's starting to warm up, so a lot of folks are starting to do some more in-person things and just continuing to do the great things that they have done all along. So again, if you have anything that we can help support, uplift, promote, we're happy to do that. Please just let us know. Okay, next slide, Cheryl. Our big project that is kind of getting into the final stages is our PSA. We filmed a portion of our PSA, which we're very excited about. We just have to film one more small portion of it. We were able to find a wonderful videographer who, it's funny how all of this works. When I reached out to him, kind of friend of a friend, and had a conversation with him, and he just simply said to me, he had a personal connection, a family connection to this whole issue. And he said, don't worry, I will take care of you guys. So he's just really a super guy. And so, like I said, we have one more portion of this PSA that we have to film, then it goes into editing, and then we're going to start to distribute it. So we're really excited about that. So hopefully in a month or two, that's going to be wrapped up. And then in terms of going forward, one of the things that we talked about over the last handful of months in our committee meeting was possibly doing some updated training with law enforcement. So that's kind of something that we have, ruminating in our committee. So so we got lots going on. Back to you, Cheryl. Thank you.
Thank you so much, Barb. We appreciate it. All righty here. Oh, there was your slide. All right, let's get this one out and we will move back to where we were. Give me 1 second here. Barb got me all boggled up here. I apologize.
I'm so sorry. Blame it on the government computer.
Tested my technical skills today, so I apologize, folks. So we will get back to where we are here. And Chief Dina, are you on?
Yes, I am, Cheryl.
Okay, so I'm going to just leave a moment here for Chief Dina to give us an update on what's going on with law enforcement and going on in the jail.
All right, thank you. And I apologize. I don't have a PowerPoint. I have yet to really learn how to use PowerPoint. So my trusty assistant, Sergeant Hall, wasn't available to put something together for me. So I'm just going to give you guys a brief overview of where things stand with respect to MAT within the holding center. So as everybody knows, the Sheriff's Office is partnering with Best Self and Save the Michaels of the world on a comprehensive jail-based MAT program. We've been meeting every 2 weeks since late January, and we are inching closer to implementation, but there's still quite a bit to do. Our current tasks are to identify an appropriate housing area, which will house the bulk of our enrolled participants while making accommodations for those who must be housed elsewhere. As everybody knows, we house a great deal of differently classified individuals within the holding center and correctional facility, and not all of them can be housed together. We have low risk security classifications, higher risk. So those folks can't be held together for risk of issues between the two. And of course, males and females aren't able to be housed together. So we're kind of working on the model. We're expecting to have anywhere from 32 to 50 participants at a time, and that's based on just canvassing that's been conducted by our Correctional Health Division and who would be eligible for the program. So our thought is that the majority of the folks enrolled would be from the level 1 and level 2 classifications, which can be housed together, which would allow us to house them all in one area. That's going to make things a lot easier for our peer counselors and direct service providers. Similar to what's been done in Niagara County, all of the services will be right on that housing area. And then what we will also, again, need to work out is how are we going to service those folks who are not able to be housed there? So all that is in progress. Best Self and Save the Michaels are working on establishing a programming schedule. Our thought right now is that Best Self will be in the building Monday through Friday during the day shift between 7 and 3. And then Save the Michaels will have their peer counselors in the facility on the afternoon shifts and on the weekends. So it's really going to be very intense coverage of folks on the housing area, working with the clients to ensure that they're, progressing through and remaining engaged. Most importantly, and the most fun, has been transferring the available funds that were made available by the county from the Department of Mental Health to the Erie County Sheriff's Office. That requires a legislative resolution, which I'm told can't really be acted upon until the county passes their mid-year budget balancing resolution, which is May 12th. So that is all in progress right now. And then what we are also starting to talk about is program sustainability. There was an initial pot of money made available for this purpose. That is not going to last forever. So we're starting to explore different grant opportunities and different ways that we can ensure that this program remains funded in perpetuity. Kind of along with that is we're starting to look at staffing. Right now, the jail management division is still understaffed with respect to the positions that we lost during mid-year of 2020 when we were at the height of the pandemic. We need to get those positions put back in so that we can add staff to the programming area, which is what I oversee, the community reintegration division. It's about culture change, and we don't just want our deputies being security. We want them actively engaged in an individual's recovery, and it's a model that we've seen work not only in other jurisdictions within the state and the country, but also in our own agency with New Dawn and Project Blue, both partnerships with community providers where our security staff are actively involved in assessment, referral, and day-to-day contact. So it's a model that works, and it's where we want to get to, but we have to get ourselves back to a level where our line staff aren't being mandated to work, double shifts 3-4 times a week. So that's where things stand. We've got another meeting, not this Thursday, but the following Thursday, and I'm hopeful that by our next task force meeting, I'll be able to report out on the program's implementation. Thank you.
Thank you so much for sharing, Chief. This is really exciting. As everyone on this call knows, we have been waiting with bated breath for this to occur. So really great news for our community, and we'll look for the updates at the next quarter. Thank you so much again. On that note, I will turn this over to Kaylee Loughran. She's going to do the report out for matters today. Kaylee, are you able to unmute yourself?
Hi, Cheryl.
Hi, how are you?
Good, thanks. Alrighty. Good morning, everybody. Thank you for being here. My name is Kaylee Lochran. I'm the program manager for New York Matters, and I'm here today with my colleague Shay, so I'll have her introduce herself real quick.
Good morning, everybody. I'm Shantasia or Shay, Program Coordinator for New York Matters. Thanks for being here.
All right, great. So unfortunately, Dr. Lynch isn't able to join us this morning, but we're just going to give a quick update on kind of where Matters is at right now. So next slide, please. So we'll start out just with a couple updates on expansion efforts across the state. Next slide, please. So really over the past year or so, we've really been working to expand the Matters program outside of just emergency departments. So starting to partner with some correctional facilities, EMS agencies, some inpatient hospital units, law enforcement, as well as a couple of telemedicine platforms, which we'll touch on in a couple of slides here. But all of these locations can utilize the exact same Matters referral process to refer their patients to outpatient MAT clinics. So we've really started to expand our footprint outside of just the hospital setting or kind of traditional medical environments. Next slide, please. And then here's kind of a map of where the Matters program is today. So over the past 2 to 3 months or so, we've been busy onboarding 8 regional care coordinators who have been deployed all across New York State. And their job is to really expand the program in their specific home region. So as you can see from the 2 different map views, the one on the left-hand side from this past November, and then the one on the right-hand side, which is the map today. As you can see, we've really been able to expand the program, not just in Western New York, but all across New York State with the help of these regional care coordinators. I'd also encourage you to take a peek at this map on our website. It's a more interactive version, and you can click on all of the different locations and kind of see exactly where they are. Next slide, please. Here's just another quick shout out to all of our new partners. This is from the last quarter or so. So we're excited to have partnered with a new pharmacy, Dwayne Reed. Most of those are located in the downstate region, but we're super excited to have them on board. And just another quick shout out, thank you for everybody on the call today who is a partner in the Matters program. And a thank you to all of the new partners over the past couple months as well. Next slide, please. So we'll just touch on a couple new projects. Next slide. So to start, we have a very exciting project that's anticipated to go live in 2 short weeks here. So in partnership with Best Self, Value Network, and UB Addiction Medicine, there will soon be a 24/7 virtual medication-assisted treatment center here in Western New York. Very, very simple to access. Patients or individuals who might be working with patients simply have to call the number on the screen there to request an immediate telemedicine consult. And then the individual on the other end of the phone, so the coordinator who's on call at that time, will connect the patient pretty immediately, probably within about 10 to 20 minutes or so, with the telemedicine provider who's on call at that point in time. So they'll be evaluated for buprenorphine, and then they'll also be given a Matters referral at that time, and they'll be given access to all of the usual resources through that Matters referral, so linkage to peer services, and then also access to medication vouchers as well as transportation vouchers through Uber Health. So that's very excited and anticipated to go live in 2 short weeks. So we'll definitely keep you updated on that. Next slide, please. And then one other telemedicine update that I wanted to give. So this program has been live for about a year now. We've been able to partner with some local law enforcement agencies as well as some outreach agencies, and they are able to directly refer any individual who they come in contact with or are working with to pretty much the exact same thing. So to an immediate telemedicine consult, they'll be evaluated by a provider pretty rapidly. And then they'll also have access to the Matters referral and also to those additional resources. So if there's any police departments on the phone or on the call today, rather, who might be interested in participating, please definitely do reach out and we can get you set up with the program. Next slide, please. Alrighty, and I will pass it over to Shay.
Would you mind just going back to the previous slide, please?
Sure.
Thank you. So we are looking to further expand the Matters program into OBGYN offices. And so as a reminder, we offer rapid referrals to outpatient MAT clinics. Additionally, we offer medication vouchers for those who are uninsured. We provide Uber Health transportation to any patient, and that covers a round trip ride to and from the patient's first clinic appointment. And then lastly, we also provide linkage to payer services to those that are interested. If there is any OBGYN offices on the phone today or anyone on the call who is interested, we would love to partner with you. And my contact information is listed below, so feel free to reach out.
Good. Thank you.
Yeah, next slide, please. Thank you. All right, and then we'll just provide a couple of updates. Next slide, please. So on our website, there is a new telemedicine video. It is patient-centered, and it walks patients through the telemedicine process. So what to expect before, during, and after their telemedicine consult. So if anyone is interested, feel free to watch the video on our website. It's very informative, especially from a patient's perspective. Next slide, please. All right. We are also excited to announce that we will be launching our app this summer. So our app will serve as a resource for patients, providers, and outreach and peer organizations as another way to easily access the referral platform to link patients to outpatient MAT clinics. So more to come on that, but we're super excited that this app will be launching within the next couple of months. Next slide, please. And then lastly here, we do have referral stickers with QR codes. So the QR codes directly link you to our referral site. And so for any of our participating partners, if you are interested in receiving any of these stickers with the QR code, feel free to reach out to Kaylee or myself, and we can send some out to you. Next slide, please. All right, and then yeah, as a reminder, our newsletter, we have a newsletter that comes out quarterly. So if anyone on the call is interested and that's not already participating in our newsletter, feel free to sign up for our newsletter. And you can do that by checking out our website. Next slide, please. All right, and that concludes our presentation. Thank you all. And as always, if you have any questions or would like to partner, feel free to reach out. Thank you.
Thank you so much, Shay, for it's really great information. Every time we hear from Matters, there's another expansion, more way to get people to treatment. So we're really excited to have you here. Thank you so much.
No problem. Thank you.
Yeah. On that note, I'm going to be Dr. Burstein for a moment for you and share her presentation. She is unavailable today, not here. So we are going to get a little bit of update on the deaths in the community. So I'll share what the provider group is doing and what she has shared with me to share with you. So have some patience with me. I'm sure I'm not as good of a presenter as she is. So our opioid deaths in Erie County continue to increase, as you can see here. In 2020, we ended up with 246 deaths. In 2021, actually, I checked, we have 284 confirmed deaths, and there are 2 pending currently. For 2022, right now, as of today, there are 22 confirmed deaths, and there's, I believe, 106 pending. So that didn't even get to the slide at this point. Pending means we're awaiting the toxicology results to find out what actually was the actual cause of death. Polysubstance is out there, so it takes a while to get this back. So we're also looking at the ages of folks. The ages are changing. We are seeing an older population. Historically, our average age of death was a 38-year-old male. The past couple of years, it's been creeping up. We're at about a 44-year-old now. So different folks, children we always talk about children. They pull at our heartstrings, but as we can see, this is not a child's disease. They may initiate as a young person, but that's not where we lose them. We're losing people today 40 and over at really rapid rates, disproportionately when we look at the number of deaths compared to the population. Another thing that is changing is the demographics. This is mirroring what's happening all over our country. We are seeing more people of Black and brown skin being affected here. We are losing more people. Our ages are changing, as you can see here, drastically. That 40 to 49-year-old age group is really being hit, as well as 50 to 59. Much different than in the past. We've talked about our white population, our Black population, our Hispanic population. It is increasing rapidly, as I said, in communities of color. We need to get good messaging, we need to work collaboratively, and we need to work on stigma in our community. This disease affects everybody. It does not matter who you are. National trends are changing also, folks, and as you can see, this is national. The steepest curve is among African Americans and Native Americans. We are seeing the same here. Our Native populations locally actually have really taken the bull by the horns, and they are looking to open an OTP up in our community. The outpatient treatment program would service the rest of the community members also. Really great community partner. This is how we work together collaboratively. All of our populations are being affected, but certain populations are increasing deaths rapidly, and we need to change these numbers today. So here in Erie County, our residents at time of death, it is becoming more urban. We are seeing more in the city of Buffalo. It is not zip code specific. It is not inner city specific. It is all over the city. We're seeing a lot in the North Buffalo area, a lot in the South Buffalo area. But as far as one particular zip code, no. We continue to look at this information to develop appropriate outreach strategies, to reach out to people into the community, to offer them linkage to care, and to offer them help. Real-time data is critical. We really need to know what's happening today because the populations are changing, the drugs are changing, the interventions have to change along with them. This is the really scary part, folks, and I want people to be aware. The fentanyl is what is killing people in our community. As you can see, we have very little heroin in our community. We all talk about heroin. We know what that is, the original opiate, and that tends to be what people just allude to when they talk about street drugs. Well, we have learned here in our community, everything out there today is pretty much fentanyl. Fentanyl is a very strong opioid. For many, many people, it's one time and we no longer have them anymore. We've lost them. These opioids are very strong, 50 to 100 times stronger than the heroin on the street. So understanding how strong the drugs are out there, and we're seeing this in the toxicology screens. Now, I do want to caution you, though, this is not single substance. It is polysubstance. There are many, many different substances in people's body fluids. The one thing we are seeing that really isn't changing, and this is really scary, this is different. We are seeing the fentanyl in our stimulants here. When we talk about stimulants, we've been tracking the cocaine in Erie County. We're now looking at methamphetamine. But as you can see here in 2021, over 40% of our deaths, over 40%, involve cocaine and fentanyl. This is a different person generally. They are not expecting an opioid. Cocaine tends to be a very social drug. We've really been focusing on getting messaging out into the community through providers, through partners in our community to have people be safe, make sure they have Narcan. We prefer if you do not do cocaine, but the reality is people are, and we need to have them with us. This is an individual that is not anticipating an opioid in many cases. They think they're having a party drug. It's not a party drug today. It's killing people. So we continue to look at these associations, and they're looking at it statewide also. I brought up the stimulant use of cocaine. We're also seeing methamphetamine. It's becoming increasingly available. New York State Department of Health released a report about 2 days ago, actually talking about the prevalence of methamphetamine and fentanyl. These death numbers are increasing in New York State outside of New York City. As I said, here in Erie County, we are starting to see the methamphetamine and fentanyl numbers creeping up. We see them more in the southern tier, but we continue to monitor this, and we're monitoring it daily to see what is in people's toxicologies to get the appropriate messaging out there. So sharing what New York State Department of Health has shared with us here, I mean, we really see what is happening here in the big, big jump when we talk about deaths involving methamphetamine between 2019 and 2020. They exponentially went up. Is it something to do with COVID? It may. Were people not there? We're not sure, but we are going to be really reaching out to people. And as I said, locally, we will be looking at the data much more closely. We will be looking at the individuals to see if this is becoming into our community. And if so, we'll work with our treatment providers, with our prevention providers. We really need to work on getting good messaging out there and good safety measures out to people. So the counties with the highest overdose rates, including methamphetamine, include Erie County. As I said, when we're talking about that, that's a significant number when we talk about it. It is not in all areas of the county. It doesn't appear to be concentrated. So messaging out in the community is hard, folks. And that's what we're looking at, getting the correct messaging out in the community. Now, when we talk about 29 deaths, when we look at the scope of all the deaths we had, it is a small number, but it's increasing. And we need to get ahead of this. So we're really going to be aware, and we're going to address this early, get messaging out with people as we continue to do. So expanding our medication-assisted treatment into the primary care offices. I was really glad to hear the treatment provider group talk about this also. This is a collaborative effort. Dr. Dosher has been leading this charge, really amazing, working with primary care in the Buffalo Medical Group area, Dr. Darren Caparasso, the leader in the primary care area. So we have lessons learned from this primary care champions group. We're collecting partner participants' suggestions on how do we change the system to facilitate expanding MAT. As we all know, reimbursement needs to be changed. The dollars really are not as supportive when you're in a primary care agency to want to do this. We're involving the health plans, having conversations with them. Consideration for treatment agencies' roles, the looking at the hub and spoke model, standardizing that in many areas, really understanding that we can make this work. We need to connect the right people together. Any suggestions that anyone has, people that would like to work on this, please contact myself or Dr. Burstein, and we will really work on getting this appropriately embedded within the primary care offices. The interest is there. What we're hearing from people too, once again, reimbursement. We need to make sure that it is appropriate in the primary care world, at least brought up to what it is in the treatment agency world. That give and take can really benefit the patient. So I will move forward onto the Naloxone work group now and report out for my group. So any questions that you have for the provider group, please make sure you put them into the chat. I will, if I do not have the answers, I will get them from Dr. Burstein and the rest of the provider group for you and send them out to you. So please, and anyone that is interested on working on the primary care project, getting good information out in primary care, engaging the primary care providers in treating their patients, linking to treatment providers, please reach out, absolutely. So thank you again. So my work group, the Naloxone work group, I'll report out on what we've been up to. And we've been busy. We've been very, very busy, to be honest with you. Things are changing. Harm reduction is critical, and that is what we are, the Office of Harm Reduction. So we've done a lot of trainings, as we always do. And this is just one component, one area where we've done some distribution. We have multiple reporting systems, but we distributed about 2,500 kits of Narcan in the past quarter once again. We've been training people, and I want to thank Chief Dina, individuals released from prison. I can't say enough. Everyone that comes out today is getting a first aid kit. They're getting Narcan. And if they're in part of the New Dawn and the Project Blue program, they're getting an enhanced kit. They're getting peer connection. They're getting all kinds of information. So we've been able to interact with individuals released from prison like we never had before. Wonderful connection and getting people linked to care. We do mailings, we do virtual trainings. We're just trying to do anything we can to get this message and tool in people's hands where it needs to be. We have changed our outreach. COVID-19, really, we had to do things differently. Nobody was out in their traditional places. People were disconnected from their regular care. So we started doing pop-up events in the community. We're very lucky. We have a vehicle here. It's called the Live Well Erie van. We standardized something we call curbside care every Tuesday downtown here on Pearl Street. We're interacting with the homeless population. We are interacting with people released from jail, getting them linked to care. People can receive a variety of services. On Thursdays, we're at St. John Canty, and on Fridays, there are various sites where we are attending. Anyone in this task force who finds a place and you think there's a place where there's a real deficit of servicing and that this would be beneficial for the community, please reach out to us. We're offering vaccines, we're offering STI testing, HIV, Hep C testing, clean syringes, let me go down, Narcan, peer connections to matters. There's all kinds of programming for people, and it's really about meeting people where they are at. And we've learned there's so many pockets of people. Curbside care is what I talked about, and you'll see the signs up there. They are expanding for other areas. And like I said, if you do have areas where you think this would be beneficial, please reach out to me. We will assess the state and try to get people out there for you. We continue to do drug and needle drop-offs, and the sheriff maintained locations have really grown. There's quite a group of them there, as you can see. There's a bunch of local municipality locations, and they're also outside of Erie County. There are 67 places, I believe, today where you can get rid of old medications. We continue to do burns, and these numbers are amazing of what people have in their homes that they save, they get rid of. These kiosks, and I want to show you these. This is where we need to get rid of old medications and old needles. Medications are burned at Covanta Energy. They recapture it. They make electricity out of it, so it's not getting in our water table. Needles are collected by Advo Waste, which is a medical waste hauler, so they're gotten rid of appropriately. If someone is struggling with substance use disorder and you have old meds, they can't just leave them sitting there. So get rid of them in an appropriate way. To give you a scope of what we collect, this is amazing when we look at this, when we look at the numbers of drugs and needles we collect here. Incredible. We had to replace 4 kiosks this year just because of wear and tear. They've been out there about 20 years. So I think that's a pretty good life that they've had out there. So they do last quite long. If you know of places, let us know. The point is available. If you scan the code there and go on there and you put in your zip code when you get to the site, it is a GPS locator. It will pull up all the drug and needle disposal kiosks that are all around you across New York State. It's a good way to securely get rid of things. It's anonymous. Nobody tracks anybody, but they're out of the hands and they're out of the environment too. We don't need them in the garbage or the water. So we've continued to work on harm reduction. I was really pleased to hear this here from other players in our group here. Harm reduction has been our focus here in public health for many, many years. And we wanted to look at what the community was learning in harm reduction too. So we're in the position now to do our annual community health assessment. And we're asking consumers about what they know about substance use and their interest also. They said we have state data, we have local data, we have death data, but we also need to know what the consumer is willing to do about this. So that's where this comes from. We're very lucky to have a team of students here that have been working on this from the University of Buffalo. So I want to give them credit for all their hard work. So the community health assessment, is, and this is done every 3 years with Erie County. It's a survey to Erie County residents. This year we had about 1,400 responses, and it was pretty diverse by zip code. We looked at it to see if it was the same as our clientele. Ages were pretty diverse also, so it looked the same as our clientele we're working with in substances. We looked at gender. This is a complete flip. Now realize these are survey answers. People being affected by opiate use disorder are 3 to 1 male. We got answers from surveys 3 to 1 female. So it's a little bit skewed. I want you to take that into account. We looked at race and ethnicity, and this is pretty close to what we're seeing in our deaths and our effects that's occurring in our community. So it's pretty good information there. We looked at the top and we asked people in the community, what are the top 5 health issues you're interested in? And interestingly enough, opiate use disorder comes up right in the middle. So this is the interest of the community. So they are interested in finding out what's going on. We looked at the areas of most concern. And we compared it to when we did this 3 years ago. It is still there. It has fallen down lower. People are very interested in other things, such as around in the past. But they are interested, which helps us develop, yes, the report's publicly available. This helps us develop, new and good responses. If someone is not interested, they're in a different place when we talk about the stages of change. They're in pre-contemplation, so we have to get different messaging. We looked at what they're interested in learning more about. Now, this was really a heartbreaker because they're not interested in learning any more about opiate use disorder. Kind of scary. That's about the motivation, pre-contemplation. So we looked and we compared it. What they were interested in learning about versus their concerns. They're concerned about opioids, but their interest in learning is different. This can go with stigma. This can do with all kinds of reasons. We'll do more research to find out why. We did ask people directly in the past 30 days, what drugs have you used in excess? Recreationally? Are they legal? Are they illegal? The biggest number is marijuana. This was put in place before, honestly, we knew that this was legal. Over-the-counter painkillers are huge still. We know this, but people are still using opioids and opiates. So we have to be careful. We know they're still out there. We can develop responses. We asked people if they've used opioids in the past 30 days. This is very good to see that the number has gone down further. We looked at gender. The gender continues to be, I mean, interestingly enough, the death number is more males, but the people that are utilizing opioids are more females. It could be due to the skewing of the responses, and that's what we think it may be, but we will dig deeper into that. This also supports, though, what we've learned about opioid prescribing, asking our Medicaid Inspector General. We know today that middle-aged women, in particular, are still getting opioid scripts. Other populations, not as much, but middle-aged women still are. So we looked at these inferences and we wanted to figure out what was going on. And we're looking at the data many ways. We'll put this out there so you can use this data for yourself. We looked at the demographics of people who said they've used opioids. The number is small, but it pretty much lines up with what we are seeing when we look at the mix of what we are seeing in our community of people we're losing. We looked at it by race and ethnicity. Now realize this is self-report. The numbers are not that high, but people are reporting use. So now we can develop messages that are very specific to communities with their input so that it's a culturally appropriate, it's a gender appropriate message that will resonate with people who are looking for help. So we looked at the race and ethnicity, we looked at all the respondents, and it really aligned. So the data is there, folks, for your use. The incidence is there, and the usage is there. We looked at income. We've looked at all these different areas. I'm not going to go into detail. You're welcome to use this. Then we talked about Narcan. We're the world of harm reduction. And people know about Narcan, which was a really good thing because Narcan is first aid. Now, have people been trained on Narcan? Not a whole lot, so we're going to increase our training numbers, as you can see there. But they are aware, so that's huge. They didn't used to be. Did the program, and we wanted to know this, did their training program give them Narcan? There was quite a while there when people were doing trainings and they would not give them Narcan. They were sending them to the drugstore. New York State would prefer if we did that. The problem is they don't always have it in stock. So we've developed the text for Narcan, other programming to get that information and that tool into people's hands. And we asked people if they were interested. Yeah, they are. And we asked if they've administered it. That's quite a high number, folks. 110 people have saved someone's life. So, and I do want to leave you with something here, and this is something that we can never, ever forget. Our Office of Harm Reduction here will be focusing highly on stigma. We know where stigma exists, people don't get the help that they need if someone feels that they're being judged. Words Matter is probably the most powerful piece that is coming out of our office. We will share it with everyone. It will be on the website. Please put this on your websites, put it in your waiting rooms, put it far and wide. If people are feeling they're being judged, they don't come for help. So words matter, folks. Everybody matters. And on this, I will turn it over to Deb Smith to report out on what the family's doing. Hi, Deb. How are you?
Good morning. Good morning, everyone. I'm fine. Thank you so much, everyone, for coming out. I appreciate the opportunity to be able to represent families in our community as they have taken the cause to the task force and asked for the response that it appears that we have gotten. Everything that we've asked for pretty much has been worked on or delivered. So we're very grateful. Could we go to the next slide, please? We are your friends, your neighbors, your coworkers. Excuse my throat. We're families who have been affected by the opioid epidemic. We are passionate in our mission to assist your families and other members of our community with not having to endure the difficulties that we have endured by this disease. We're the people no one wants to be, and we want to save you from that particular place in life. Life is difficult enough. We have a lot of struggles, other struggles, and burying our children should not be one of the things that our community looks at. is a possible outcome. We need to save all lives who are in the grip of addiction, and we have to do it with the collaboration of each other. As far as our group goes, we traditionally are the people who have to say we need more. We're very grateful for everything that we have, but we're the people who have to do that little extra push always. It doesn't put us into an enviable position, but it also doesn't reduce our gratitude that we have for all of the different programs that are coming up. The number of times that we've heard through today's presentation, meet them where they are, has been healing for us because we know that our loved ones are cared about. Could we go to the next slide, please? We have different functions that we do in order to raise awareness throughout the year. We have Black Balloon Day that happens on March 6th. This year was a virtual Black Balloon Day. I believe it went over wonderfully. The health department was able to secure balloons. We put them on our porches in order to raise awareness in our communities that people we love were taken in a tragic manner. Before that, we had the Tree of Remembrance. That Christmas tree is put up in the lobby of the Rath building, and we have the pictures of our loved ones as a display on the tree to show that we're missing them at holidays every day. When the tree first went up, I believe it was about 6 years ago, it didn't have nearly that many pictures on it. It looked a little sparse. It's become very full, and that's a concern. Also, we have opioid, International Opioid Awareness Overdose Day, which the health department, Dr. Burstein, Cheryl Moore, as you can see in that middle picture, presented what are replicas of tombstones of our loved ones to show the number of people who have passed in our community. This is not the total number of people who have passed. There are many people who choose to fly below the radar. They do that because they wish to protect their loved one, even in death. And because of the stigma, they're uncomfortable with coming out and saying, this is the reality of our situation. We represent them also. Next slide, please. Part of what we do is that we lobby for funding. In 2015, when we first approached the Erie County Legislature in November, we asked for federal dollars to come into this community in order to heal us, in order to help those people who are struggling. We joined together as a group to lobby for that money so that we could get answers in life-saving programs introduced. The pictures that you see along the bottom were in a box that were sent to the White House in order to raise awareness of the number of people that we've lost in our community. There's one of the pictures is of a Narcan box that was put up by a grandfather who lost his grandson to this disease. And he made Narcan available to his community. Could we have the next slide, please? Our next slide is an effort that we have expressed since 2015, which is harm reduction. We want every life saved. We know harm reduction is not a perfect plan, but it is a plan to keep people alive until we can make a better plan. We encourage life because a person doesn't just bury their loved ones. They bury their future, their hope, their dreams, and the joy of their entire family. We carry this with us to the end of our days. There is no relief. There is no, it's going away. We have to adjust. And that is a very difficult reach. So we are encouraging harm reduction in any way that we can in order to save lives. Could we have the next slide, please? Harm reduction begins with language and respect. We have to be supportive of our loved ones. We have to drop the negative connotations. We have to present our loved one as the kind, loving people that they are, minus the disease. That they are not people who are addicts. They are people with substance use disorder. In order to talk about urine tests, saying substance clear toxicology sounds better. I think we have to cushion our language. We have to present it. This is such an emotional disease. It is emotionally fueled, it's emotionally driven, it's passionate, takes no hostages. Shatterproof language does have, as Cheryl Moore did have up, language man. Words matter. Shatterproof also has a language guide that they provide. Next slide, please. We have challenges in saving lives and securing patient-first, respectful treatment for those struggling. I know that the people of our community want best for everyone in our community. We want the outcome to be good, productive, healthy people. And that's our goal. Thank you so much for everything listening. Sorry about my voice. Take care. Thank you.
Thank you so much, Deb. Thanks for sharing. I know it's not easy. As you can see, our family group continues to advocate and really work on behalf of people that we've lost and people that we don't want to lose. And that's critical in our community. So we've done so much, as you can see. Next event they have coming up is International Overdose Awareness Day, and I believe there's a lantern. We're going to participate in the lantern event. So we'll put that all on the website for you. So in Erie County here, I mean, we always talk about it. I just want to give you a little update on the Office of Harm Reduction, the annual report. We do run the task force for you with your input. So making sure that we're hitting all the areas that we've been asked to do and putting it out there for you. So we're looking at Narcan overdose prevention training to give you a scope of what's coming out of just this office. It's huge when we look at number of kits that are out in the community. When we started, really looking at numbers out there, we had about 5,400 kits in 2018 distributed. In 2021, we distributed over 15,000 Narcan kits. This is the first line of defense, and anyone in the community that needs this, please let us know. Supplies, training sessions to give you an idea on how those kits went out. We have backup supplies, we have case management, we have wall units, we have techs for Narcan today. The wall units look like this, and to give you an idea of the scope of them, you will see them in the community. If you do not have them in your agencies, in your churches, in places where people gather, please reach out to us. We will get the wall units to you. They are simply first aid. It's about having the tool available for you. There is no cost. We will provide you with the supplies. Text for Narcan is out there. That's been huge. Narcan as first aid has been huge. Our peer support. Our COPE group meets 2 times yearly. I heard about the peer group in other areas. We also are training folks here. So folks that need to be trained as a SERPA-P and then get your time frame in, we'll be putting out another training session for you. Options for people to meet their need. I heard, once a week for 6 weeks, depending on what they need. I have a group going through right now. They did the training in a week, but they trained every day. So whatever works for people is what we're really looking at today. We get rid of syringes and medication. It's crazy. Here's the syringe amounts that we've gotten rid of and the medication amounts in the community. Absolutely unbelievable. And we talk about old medications. We know 86% of people struggling with opiate use disorder today started with scripts. Don't save them for a rainy day, folks. Please get rid of them. They're burned by Covanta Energy. They kind of recapture it and make electricity, so it's a little green. We also have the Opioid Mortality Review Board, which has become a formalized embedded unit now. We'll be meeting 4 times a year. The recommendations that came out from our initial research project for the first 3 years We need to reduce the stigma around substance use disorder. We're all saying the same thing. We need to recognize and address ACEs, the adverse childhood experiences. So looking at programming in our community to expand, to address ACEs, critical, critical. This came out from all of the records. And then access to early treatment, as we're all talking about. So on this note, I'm going to turn it over to Elizabeth Terranova to give you a little update on the 8-county project that she has been working on.
Next slide, please. So we are in our last year of this grant. This is a region-wide initiative focused on getting Narcan supplies and training out to the full region, as well as ensuring proper connection to treatment. So for the outside Erie County region, for the first 6 months of this last grant year, over 100 first responders trained, almost 200 community members trained, and about 120 folks trained through outreach and case management. Next slide, Cheryl. So you may see these billboards back up again. We have them up for April and May. The reason is we saw a great response the first time that we put them up. We really want to make sure that Narcan is available, that everyone knows how to use Narcan and knows where to access Narcan. As we've seen from the data, we're not only talking about people who knowingly use opioids or ingest opioids, we're talking about folks that may not realize that there's an opioid involved. So we want Narcan to be as accessible as possible. To date, through our Text for Narcan program, about 2,700 kits have been mailed out to 2,400 people. So this continues to be a really great source to get Narcan supply out in the community. And please spread the word about this as well. Next slide. Cheryl talked about the Narcan wall boxes. To date, we have about 1,200 wall boxes out in Western New York. We are able to mail them. We ask folks to take a look at them on a weekly basis, a daily basis if needed, and let us know when they need refills, and we'll be able to get refills out to them. Please reach out to us if you know of sites that could use a wall box. We tell sites it's just the same as having a first aid kit as having an AED on your wall. If you already have one of those on your wall, then put this next to it. Next slide. So outside Erie County in Western New York, you can see we have the majority of Narcan supplies distributed through trainings and supplies to first responders, community organizations that train. About a quarter of our Narcan supplies have been sent out through the text line and wall boxes. Next slide. The peers have been doing amazing work working with clients. They have partnered, we've partnered with Matters so that they're able to get folks into treatment, able to get medication for folks very quickly. They're able to reach out to folks after overdoses through overdose reports and from first responder reports. We also have peers very involved in outreach, our in-person outreach, and so they're able to talk to folks that we may never see, we may never be able to reach out to. And making that personal connection is really important when we're working with clients. Next slide. And Cheryl did talk about COPE, our community of peer enrichment. This is a peer group that we started across Western New York for peers who are in recovery to be able to have a space for themselves to learn new skills and to network and to get support from one another. We were able to have an in-person training, which is great, in March. We were able to reconnect. And what did we work on? We had communication skills training, and we did do some self-care, which was really fantastic. Our next HOPE meeting will be in the summer. If you know of anyone who is a peer and would like to be involved, please reach out to us and let us know, and we'll be sure to include them. And back to you, Cheryl. Thank you.
Thank you so much. Appreciate it, the update. Next up, we have Anita Robillard, and she's going to let us know what's going on in the probation department.
Ooh, here I am.
There we go.
Here I am. All right, we can move this slide forward.
Mm-hmm.
Right, so usually what I do is just kind of give everybody an update on our unit. Right now, we have 30 probationers again. The last 2 months, we had rotated through several people, and we were down probably 27, 28 for a little while, but within the last, I would say 2 weeks, we've probably added 4 new probationers to our unit. Our peer navigators who provide support to all of our 30 on the opioid unit also support another additional 26 people that happen to be on other caseloads. So they're doing a yeoman's work, and it's nice to know that we have 2 now. We have a peer that started in January, and she's doing a wonderful job. We had 1 probationer who was granted an early discharge by the court. So we had submitted a letter basically saying how well they were doing and that we didn't think that they needed probation anymore, and they were solid in their recovery, I might add. We do have a probationer who unfortunately decides that they don't want to work with us, so we don't know where they are, so they are transferred to our absconder unit. We have 3 active violations of probation. We had recently actually had several more, so it's gone down, but these are people who have, most of them have been rearrested, and that's part of the violation of probation. One of the things that we try to do with our opioid unit is we hold off on filing a violation of probation until we feel like there's nothing else that we can do, unless they've been rearrested, because in that case, the judge might order us to do that. At this moment in time, we have 4 probationers that are currently at inpatient facilities, and we have 1 probationer in jail, which isn't through us, actually, it's through a previous conviction that she's, I guess, finishing up. Unfortunately, we did have in April 1 fatal overdose of a gentleman who has been on our unit, I would say at least 2 years, which is sad. And we had 1 person who had a non-fatal overdose, and that person, I'm going to follow up in the next slide. So if we want to go to the next slide.
It's going.
Maybe, hopefully.
You're there.
Oh, there we go. Like I said, 1 person, we had a fatal. With the person who experienced the non-fatal, we have an established protocol for our unit that we follow up within a short amount of time of finding out about the overdose. Sometimes there's a time period that goes by before we find out, but they are now linked and are one of those individuals at inpatient treatment. So also, we keep tabs of what we've distributed in our department, and so far, just this year alone, we have distributed 20 Narcan kits to probationers and their families, and we have also recently added fentanyl testing strips to kits, so that if somebody wants to use that to kind of make sure that the stuff that they're using does or does not have fentanyl in it, we have that provided for them. In May of this year, we will be giving our release under supervision officers, those are otherwise known as RUS officers, the ability to request an in-person meeting with our peer navigators. Because people on the release under supervision are not formally on probation prior to conviction, they haven't been able to get the full benefits of our peers. But what we are doing is we're going to add that if an officer identifies somebody that could use a little bit extra knowledge or support, we will arrange a one-on-one meeting so that a peer navigator can kind of share information and some education. So it's coming from a different source than a person of authority. And then the idea is that the peer navigator can be contacted at any time by that person, but it's more driven by the person than the peer navigator going out and then keeping them in the loop. So that is, we want them to be part of the whole, I'm sorry, I lost my train of thought because I had somebody yelling in the house. Anyhow, we want the peer navigators to take a little bit more active role in that population within our probation department. We are also working on trying to get peer navigators to distribute Narcan and provide information at the victim impact panels that probationers have to attend. It is required for anybody who has a DWI or a driving under the influence, which could include being impaired by opioids and other medications. We've had a couple of glitches, but hopefully we will get that ironed out, and in May we hope to have them there so that they can provide that information to that population also. So just to, again, it's the messaging, it's the getting the information out there, it's getting the Narcan, and the message that it's just part of first aid.
Mhm.
So, okay, let's go to the next slide. I took a picture the other day. This is our peer navigator, Kathy, and she is meeting with a probationer in the office. So you can kind of see what that looks like. There is another desk in there, but that seems to be going well. Mondays, which is today, is report day. So Mondays are quite busy with people coming in and out of the office and them just touching base, helping them, providing resources, and in general, just supportive. All right, next slide, please. Okay. So our grant ends September 30th. So we have a work group and we're looking at all the options available, trying to keep the current configuration of the opioid unit with an officer and 2 peers within our probation department. Maybe if we can, maybe expand that. We are still doing interactive journaling. So this is a cognitive behavioral intervention. We have 10 probationers actively working on interactive journaling. Another 21 have started. I laugh because it's one of those things where, you know, you're going to get some people that just aren't interested, and we don't necessarily want to push them. We'll push them a little bit to see if they can kind of work on some of the workbooks, because it gets them to think about their situation a little bit more. But again, we're not pushing that. But we do have some probationers that seem to love it, so that's great to see. And initially, when we started the interactive journaling, we only did 5 of the series of 9. So we will be actually looking before the grant is over to purchase the other remaining workbooks in the interactive journaling set so that we have them available, because it's different topics, and I think they're all important for our people to go over. So. And then our last slide, because this was kind of super short, is just this is what our unit consists of now. We have the supervisor, the probation officer, and our 2 peers. If anybody has any comments, suggestions, I welcome them. So that's my email address on there, and I appreciate being a part of this group, and I look forward to finding out all the different ways that our community is helping those that are struggling with opioid use disorder. So thank you very much. Back to you,
Thank
Cheryl.
you, Anita. Thank you so much. Appreciate it. On that note, I will turn it over to Taylor, and she can tell us what's going on with Healing Communities Study.
Thanks, Cheryl. You can go to the next slide. So one thing that I want to highlight right off the bat is our work and our progress within using the telemedicine expansion of matters. Since we had started, so for about a year now, and this is only Buffalo, we have 37 successful referrals. 31 of those telemedicine visits were completed. So that may be that the person we referred to didn't make their appointment, maybe they rescheduled, maybe they did not have access to communication, such as their phones, they had to leave because we do work on the street. We do have our own phones that peers can use for these clients, but sometimes people can't stick around. Of those 31 visits, 25 prescriptions were provided. And so that's not necessarily to say that the other 6 did not receive medicine because they didn't need it. Some of them may have already had medicine and they just didn't need to get a prescription, but they do need linkage to treatment. And that 3 is supposed to be 30 follow-up appointments scheduled. So it is going very successful. I think we are all getting a little bit more comfortable. We are also expanding through our curbside initiatives as well, so we can do a really comprehensive referral process and meeting with anybody who we're serving right on the street in the comfortability of the van or the RV. So it gives a little bit more privacy. It brings a little bit more professionalism for us to the street, where the people that we're working with can be a little bit more comfortable instead of just standing right on the side of the street. You can go to the next slide, Cheryl. As Cheryl had mentioned, we really are pushing Narcan as first aid and as harm reduction. We have found, especially through a lot of our curbside initiatives, our events, even if somebody initially says, oh, no, I don't use drugs, I don't know anybody who does use drugs, we rephrase it and we say, okay, but you also go to the library or the grocery store or out to eat or go for a walk. And then it really gets them thinking, oh, yes, and I do see other people who aren't, directly in my circle. And we have gotten a lot of really positive feedback. It's also really nice that we don't have, and I don't have one sitting right here, but we don't have to give the entire kit of Narcan. This is easy, it's small, it can clip on the side of a bag, you can leave it in your car, and it seems like this is going overwhelmingly well. You can go to the next slide, Cheryl. Here's some curbside numbers. This is from when we started. I believe our first event was December 23rd-ish. We've had a total of 19 events, and curbside has expanded. So now we are bringing the truck and the entire curbside event to at least 3 different places as we speak right now. Potentially, if anybody knows of any really good locations that we could take it on the road to, give us a call and we can kind of think about it, talk it out, and see if that would be a good fit or when it would be a good fit as well. Go to the next slide, Cheryl. We are still providing some COVID and flu prevention supplies, a total of 170 vaccines. And these are specific to COVID vaccines, which is really incredible at just our 19 curbside events. A lot of first timers, which is really surprising and really incredible. We also are still providing PPE supplies. We got a really large shipment of masks as well as disinfecting wipes. And people are so grateful that we are giving these out, especially that NFTA is still requiring masks. People have said that, they're not seeing masks as often in places. And so it's great that they can still get some masks through us when we do have them. Go to the next slide. Here is just a quick look, and we've looked at this before, and hopefully soon we will have some 2022 numbers up there. But you can see the progress from 2019 through 2021, and this is a map overlaying overdoses compared to where Narcan is going in the community from our office. And so you can see that there in 2019, you see a lot more bright red, which I don't know if it's a good thing. It's a great thing that we're getting more Narcan out, so it gets a little bit darker, but it's also getting a little bit darker because of the overdose numbers as well. City proper looks pretty good in terms of overdoses to Narcan, but we really need to start expanding out a little bit outside of city proper, and definitely into those suburbs. And if you have any questions on this or the Naloxone track as well, please get in contact with us because we can send you the information on that to access that as well. Go to the next slide. So we also are highlighting a lot of our peer initiatives. They are on the road a lot, 3 to 4 days out of the week. They are doing connection, referrals, still continuing response after overdose. And eventually, once we can get more of our reports for our peer work, we will be able to see the progress that they have on working with clients from 30, 60 to 90 days, where we are getting all of our referrals from, what treatment is, did that person choose, how it's going, and really how did we respond to that as well. We also have a peer who has started going to a methadone clinic to provide Narcan. And I know they were very excited, but a little bit nervous also for fear of how not only persons who are attending that clinic would react, but also how the staff. I know sometimes we do hear that staff still, even in this field, they don't have a lot of respect. And I know that was a little bit of a concern, but I am very happy to hear that they have received nothing but support and praise from not only the staff, but also the clients, which is really encouraging and very exciting for her. She has said that a lot of the clients have expressed that even though they are not using anymore because they are on treatment or medication, there are a ton of people who still use, and they also have started and taken the initiative to bring it to their Medicaid cabs because they have said that, the drivers of the cabs are consistently driving people to and from the clinic, but also picking people up in other areas as well. And so they are leaving it right on the car, which is really, really interesting to see just that initiative. We also have started and continuing on with the MAT support group. So this is our Medicated Assisted Treatment Support Group. It is inspired by the MARA International model, okay? That is Medication Assisted Recovery Anonymous. So our one peer decided, there's really not a safe space to truly dive deep into medication and what that looks like for them. So they wanted to create that safe space, and we will see how this continues in the future, but we have heard one person had said that they think that it'll make them better at their job, and somebody else said that we all have different stories, but we are all using medication successfully to be productive in our own lives. And so really taking that time to sit and navigate with other like-minded people, not only on your experience with substance use, but your experience with medication and your truth right now, and being able to talk some of those things out is really helpful, especially, if they do work in this field or another health field. You can go to the next story, please, or next slide, please. So up and coming, we do have our fentanyl awareness and overdose prevention campaign, which I will show. I'm very excited to show that. And we are actually getting into a lot of our environmental health colleagues to get them trained onto Narcan. So we are doing this for a couple of reasons. One, because we are partnering with the restaurants. And so we really want, if somebody has a question, because it is coming from the health department, that they have a little bit of an idea of how to answer any very basic question. But we also know that not only are these staff going into restaurants, but they are also going into bars. They are also going into homes, especially if they are doing something like lead, anything to do with lead. We know that can be very risky for them to walk in, and we would really hate to see them not be prepared if they do walk into a situation or don't have any support as well. And Cheryl, you can go to the next slide. but after about a year of delays, and we will be getting these in just about a month, this is our restaurant bag, our takeout bags that we will be providing to many bars and restaurants if they request, really to warn about fentanyl and other substances. We do have the text for Narcan QR code, so not only can you text, but you can scan the QR code. We also do have the addiction hotline on there. To also go with these restaurant bags, you can go to the next slide. We have another menu of items, and I tried to blur out this QR code, so if it didn't work, just don't fill anything out, but it is where places can go and request some of these items. So we do have the takeout bags, we do have coasters, we also have Narcan wall boxes, so we do want those whether they're behind the bar or in the bathrooms. We also have window decals that people can use as well, regular Narcan, and then we also are supplying not only our Narcan training, and that can be a really quick training, but that could also be our longer, training that goes into stigma conversations as well as data. But we also want to provide some toilet talk messages. So a lot of times you see these messages on college campuses or in other restaurants or health areas like your doctor's offices, and we want to get them into some of these restaurants and bars. They're going to be very simple health messages surrounding substance use, harm reduction, Narcan, medication, recovery, peer support, and we'll have those out on a rotated basis. We also are providing condoms as well in partnership with our community wellness team also. And I think that's it, Cheryl.
That's it. Thank you.
Thank
And
you.
I apologize there. My computer decided it was going to try to restart in the middle of your slides. So my apologies. So everyone, any suggestions, any comments, any questions that you have, please put them in the chat. Make sure that they are there. I am going to stop sharing PowerPoint and open this up for us and take a look at the chat now to answer any questions that we might have. Let's take a look here and see what's going on in our world. So, going through our questions today, greetings, OTP. Thank you for answering that. OTP, and sometimes we use letters, folks. OTP is Outpatient Treatment Program for anyone that is not aware. And when we talk about that, it's generally a methadone treatment program, so that we know. Overdose deaths where a person is using prescribed Adderall. That is honestly not something we have taken a look at, but we will take a look at it now. Thank you for the suggestion. We can take a look at that and put that out there for folks. That's a good question. A question about Narcan being good long after the expiration date. Absolutely, it is usable. Those that are licensed professionals, please make sure you have it within parameters. We will always make sure that you have Narcan that is within, but honestly, keep it as a backup. Make sure you have stuff that is not expired so that you have it with you, because you just never know. If you had expired, did it perhaps, get too hot for too long? Was it the type that was temperature sensitive that might have broken? All the different reasons. But, please take it. We will definitely send you more. Don't ever worry about that. Yes, the FDA extended it. Publicly available reports, yes, everything will be on the website. We will put the PowerPoint up there. We will put the recording of the PowerPoint up there. We will put the report to the community up there. And anything else that anyone feels that they would like to share with the task force, I am happy to put it on the task force site or a link to it so that people can get the information that they need. Next, let's see here. Narcan, yes, Narcan is, and I just want to say it, folks, if somebody isn't breathing, they can't get treatment. So let's keep people breathing with us. Let's keep our loved ones with us. Let's give them the opportunity. If they don't have the opportunity, it doesn't happen. So, we really, really want to make sure that people get the opportunity to get all the good treatment that is opening up in our community. The MAP PADOA program through Buffalo Matters, that continues on. Jen, did you want to give a little bit more update on that one? Are you still on? Either John Grieco or Jen Seib?
Sure.
Thanks.
Yeah, I could just kind of say briefly, so the Matt is a grant that came from SAMHSA that was awarded to Best Self, New York Matters, UB Addiction Medicine, and Value Network. And so it's a regional project where we are building a 24/7 telehealth access to medication assisted treatment. So in essence, folks can call a number which will be out very soon. It's not out. Well, I think that actually Kaylee did share it, but it's not open yet. So please don't have people call that number. But we're hoping to have our go live date as May 16th. That's our tentative go live date. We'll be sending out lots of blasts of information as soon as we're ready. We'll have billboards. We're going to have all kinds of things. And this is for all of Western New York. So any place where someone maybe doesn't have easy access because there's just lack of services in some of our areas, or they're just, they just decide at 3:30 a.m. that they're ready for help. It doesn't matter. They can give a call. They can be connected with a provider who will assess and get them initiated on medication. And then they'll be linked to whatever place, whatever they choose, where they want to get ongoing care, ongoing prescription, and/or substance use disorder treatment, if that's what they're looking for. So we'll make sure that they get there. And then we have peers that will be reaching back out to connect with them and make sure that they, that they actually can make it to their appointments, that there aren't any other barriers like transportation or anything for them to get there. So we'll kind of stick with people and follow up on the grant's end. So so we're very, very excited that we'll be able to have this. And again, it's all telehealth. So it's not a place you walk into. So anybody can be anywhere and make that phone call and get the help that they need.
Thank you. Thank you for sharing. We appreciate it greatly. Let's see. Pastor Al Robinson, they have housing and want to know how they can get linked up with you, the rest of the housing folks. So I'm going to suggest John Greco, and I will link you together with them. How does that sound? Let's see. Next, how will we know what happened at the Take Back on Saturday? Saturday was National Drug Take Back Day, and Matt Smith asked what the results were. Honestly, I don't know. I will call over to the DEA and find out. I did work out at the North Collins site. We had a very regular amount that we normally get there. We usually get just under 100 pounds of drugs, but they don't have a regular standalone kiosk there. So the residents wait for it. As you saw with the standalone kiosks, those numbers have gone up. And hopefully it's taken away from those 2 time a year things, so people aren't saving things for twice a year. So Matt, as soon as we hear anything, I will let you know. How does that sound? We'll put it out there. And I think that's all we have here. Wow, I'm going to give you back 15 minutes of your day, folks. We're going to end early today. Thank you all so much for what you're doing out there in the community. Big changes are happening quickly. I do know that, people are expanding treatment, as we've heard of wonderful opportunities out there. There's new options out there. People are focusing on harm reduction in the community. The conversations are there. People are being more open to speaking about it. So continue the conversations. Words matter. I will leave you with that. Make sure you think about your words that you use. Sometimes just one word is enough to make someone not feel good about themselves. So words matter. You're all doing amazing things out there in the community. Thank you for everything you're doing. We wouldn't be in the place we are today without you folks all out there. Have a wonderful day. Bye-bye. Thank you all.